Hello, welcome to the Build Vibrant Health podcast. My name is Mary. Today we have Dr. Dennis on. I'm really happy to have him as a guest here. Welcome, Dr. Dennis. Dr. Dennis has more than 44 years of experience in medical and surgical care for disorders of the ear, nose, and throat, also known as ENT, in both children and adults. His experience includes endoscopic sinus surgery, balloon sinuplasty, and snoring procedures, as well as a long list of other surgeries and procedures that we can get into in the interview as it comes up. Dr. Dennis practiced privately for 44 years in Buckhead, Atlanta, Georgia. He has treated over 80,000 patients over his career, which began as a clinical instructor at Johns Hopkins in Baltimore, Maryland. He has a reputation for listening carefully to his patients so that he can tailor treatment options to meet their unique needs. He also takes the required time to proactively ask patients about their home environment and performs a unique protocol to determine if the patient is suffering from symptoms of mold, mycotoxins, or other environmental illness. Dr. Dennis treats all aspects of diseases of the ear, nose, and throat with a particular focus on fungal sinusitis and other toxins that can lead to neurological disorders such as migraines, tremors, cognitive decline, severe fatigue, leg weakness and paralysis, deafness and blindness due to mycotoxins entering the brain from a paranasal sinus. He has been a pioneer in Atlanta for several breakthrough procedures like removal of fungus balls and mycotoxins from the sinuses that have colonized parts of the body. So, Dr. Dennis, welcome. That is quite the introduction, but I really wanted to give people an overview of everything that you do and how knowledgeable you are in this area.
Thank you for having me.
Yeah, of course. So I find it interesting as an ENT because I have, as a client, as a patient, have been to an ENT before, and never was I asked, because as a kid, I grew up with a lot of sinus and ear infections. And as a kid, I never was asked about the connection between my environment. I was always just given usually an antibiotic to treat like swimmer's ear infection. So how did you come to find the correlation between your environment and sinuses?
Well, it's kind of a long story, but when you're in training, you're only seeing patients in one subspecialty area for about 3 months. And so you get a skewed view of reality. And what you're taught to do works for most patients. But when you get into practice, you find out that some of these things that you were taught does not work for everyone. And there are people who remain sick. So we had a gentleman who was always sick. He had purulence running out of his nose no matter what you did. We did steroids, antibiotic surgery more than once, and steroids, and allergy shots and medications and irrigations. And didn't matter what we did, it didn't work. And so one day this person came back in and he was totally pristine clear. And I'd never seen him like that. And I'd been seeing him for about 10 years. And so I asked him, well, you're totally well now. What have you been doing? I know it's nothing I was doing. And he said, well, we went to the beach for 2 weeks on a vacation. And I felt a lot better. So then I knew it was environmental. And then we figured out shortly after that it was mold. And then about 10 years later, Mayo Clinic published they had 23 papers they published. They discovered that the immune reaction to mold was the cause of 93% of all chronic sinusitis. And they wrote 23 other papers showing that if you take the white blood cells of patients who get sinusitis frequently, that their white cells react to the presence of mold in the test tube by releasing 3 inflammatory mediators. And that's what causes all the inflammation. So the mediators make them excrete a lot of eosinophils, which are white cells. And the white cells go to destroy the fungus. And when they rupture, they release this protein called major basic protein, which kills the fungus, but it also destroys the lining of the mucosa and the cilia. So they have these little pits. He says these are all microscopic. You can't see them. But the mucus stays in the pit, and then that's what causes secondary bacterial infections. That everyone's chasing the bacteria instead of fixing the reason the pit is there, which is the fungus. So, and that's probably half of my specialty, thinks mold has something to do with chronic sinusitis, even though, yeah, those 23 papers by Mayo Clinic. So basically, if you don't address the fungus, you can't get these people well long-term, no matter what you do.
Right.
So that's
And
how it all started. And then we discovered mycotoxins. We didn't, all the mycologists already knew about all these things, but we didn't know anything about mycotoxins. And so that came up, and then we started saying, well, these people have mycotoxins too, and that explains all the neurological symptoms that we're having. Anything you can think of is all across the board, anything from deafness to blindness to tremors, paralysis, especially cognitive decline, memory loss, concentration problems, comprehension, all those things drop down when they get a mold exposure. So
sure.
we figured a way to help them by addressing their environment. And then some of them need surgery, but not all of them, but probably half of them do. And then when they get the surgery, they get massively better most of the time.
Mm. And what would you say, how out of the clients that you see now and maybe the clients that you saw before, what percentage of them that are experiencing different ENT sinusitis problems, what percentage of those people would you say have been exposed to mold and that is a root cause of what they're going through?
Well, if they have chronic sinusitis, it's 93% of them.
And for listeners who aren't familiar with the term sinusitis, can you just break that down into layman terms, what that looks like?
Itis means inflammation. So it's inflammation of the sinus lining that's causing cooling of mucus and infection. And it occurs, more than once a year. So these people are getting sick over and over again, and it's lasting for weeks and months. And they're getting treated and then they recur. That's the definition of chronic sinusitis. So, and it can be they can have polyps. But polyps are little growths inside the sinus that look, they're 80% water, and they're an immune response to fungus. So there are really 3 different genes involved, and they're all different. So you can have chronic sinusitis by itself, or you can have chronic sinusitis with nasal polyps. They're totally different. And the polyps obstruct the airway and the sinuses and cause infections. And then when you get them out of the environment, you can treat the polyps, and the polyps will stay resolved. But as soon as they get back in fungus, they come right back immediately.
Sure. So are the polyps a type of fungal growth, fungal infection?
No, it's a growth of tissue that's a response to the inflammation caused by the fungus. So it looks like little grapes or something in there. They're 80% water and then tissue. So they're soft and they're easy to remove surgically, but they cause obstruction. And because of that, they cause infection, and long-term, you can't breathe through your nose.
Could that be a cause potentially of something like sleep apnea or inability to breathe properly at night?
Yes, so with sleep apnea, it's frequently caused by nasal airway obstruction from any reason. Sometimes it's mechanical, and sometimes it's allergy. So when you fix that, and if they have a palate problem, you fix that with it, then their sleep apnea is over with. But you can usually tell by the physical exam, endoscopic exam, where the obstruction is. And so you go from your nose all the way down to your larynx, and in between there, if there's any obstruction, you have to relieve that surgically, or they can use a sleep, a CPAP machine. Some of them need that, but if you remove the obstruction, they don't need the machine.
Sure. Right. That makes a lot of sense. And in order, what we're talking about here specifically is a lot of mold and mycotoxins, indoor air quality affecting the nasal passages, affecting the overall body. So removing the source of mold in the environment is key, and obviously number one. And then secondary would be to treat and heal, help the body heal itself. And so you have created Microbalance is a company that you have founded and that I personally have used, and I know a lot of other people have seen success using certain products, whether that be a nasal spray or a laundry additive or household cleaner to remove spores and mycotoxins from the environment. Can you talk a little bit about how um, though that was born, how those products were born, and how that might be a part of someone's treatment process to
Sure. Well, this is many years ago. There's a compounding pharmacist in my building that he and I developed about 600 different nasal sprays that were prescription with antibiotics and antifungals and anti-inflammatories. And over the years, they were very effective, in helping these people. So then once we found out it was mold, then we started saying, well, we need to offer something to help them with their environment
Mhm.
first. And so we did some research and tried to get something that would be non-toxic, and if someone or a child would drink it, it wouldn't hurt them.
Mm.
But somebody's going to drink it. And so that's how we looked up and did some testing to see what was the hardest fungus to kill.
Mm.
And it turns out it was Aspergillus niger. And so then we made it so it would it was easily kill Aspergillus niger by making it much stronger than required.
Mm.
So even if you diluted it, it would still work. So and as it turns out, if you have some ingredients um, that you pick 3 or 4 different ones that are structurally different, then your product is exponentially more powerful. So it's not linear. When you add, it's like toxicology. When you have 2 poisons, add 3 or 4, it's not 4 times more, it's exponentially more, like squared.
It's a synergistic effect of them working together.
That's right. So that's why we picked the citrus seed extracts of different citrus plants, and that is really how it started. And they're very effective, and they're pleasant. They don't hurt anybody, and so they do a good environmental job. And also, you can also use them internally.
Okay, beautiful. Yeah, I've noticed I don't like to use toxic products after being exposed to mold. I just am a lot more aware of the products that I use in my home and also on my body, and so it's really important to have non-toxic natural option that's also not going to exacerbate issues in the long term. Which leads me to a next question is a lot of folks who have mold sensitivity or have been exposed to mold then become chemically sensitive, right? And so your products being more naturally derived and having essential oils, most folks will be okay with that. Can you tell me, or do you have a little bit of knowledge around what sparks that the chemical sensitivity, and once someone is out of the environment, once they detox, say polyps, or get rid of the root cause of the chronic sinusitis, um, are there other ways that we can reduce the like reaction of chemical sensitivity? Is that something in the olfactory system? Is that something within the ENT system that needs more addressing to be able to heal that part?
Well, yeah, you know, these people that have fungal sensitivity, most of them are chemically sensitive.
Mhm.
And to different degrees, and some of them are extremely chemically sensitive. And so the reason for this happening is because it has a T cell receptor defect genetically is what causes it. And so the antigen doesn't bind at the correct site on the T cell. And so when it binds at the wrong position, it causes 9,000 times the inflammation of a normal person per mole spore.
Mm.
So, and then that makes a cascade that causes inflammation that makes them chemically sensitive. And so it's all related, but the chemical sensitivity is the exact same reaction that the mold causes. It's not different. And
Mm.
so chemicals make them more mold sensitive, and mold makes them more chemically sensitive. So these people can't have either one in their environment, or they never get better. So a lot of times they'll go and want to get a new house, and you know, all the new paint and all that, and they just crash.
Mhm.
So you really can't. You got to treat chemicals the same way you would as the mold. You try to stay away from that,
Sure.
so you can calm your system down and not keep it in fight or flight all the time.
Sure. And so when you're saying the genetics, what percentage of people would you say have that inability to process those antigens differently?
It's about 20%.
20%. Is that the same thing as like MTHFR and the HLA-DR gene, or are you referring to something different?
Well, HLA-DR gene is one of the ones involved with fungus, but there are other ones than that. Because you got people who have it and don't have that gene.
Sure.
And so the MTHFR is really important. It's different and not related to the sensitivity to fungus. So you can have fungal sensitivity and not have MTHFR.
Mhm.
So the ones that do or they cannot excrete the toxins fast enough. So those are the ones that get all the neurological symptoms.
Mm.
And then you can help them with that, help them detox. But the key is, if you don't get them out of the fungus, it doesn't matter what treatment you render, it's 100% failure rate every time. So, and the reason for that is you're breathing about 3,000 gallons of air a day, but you're only rinsing your nose out with 8 ounces. So
Mhm.
that's like being on the bottom of a dirty swimming pool where the water is brown and you're sitting on the bottom trying to rinse the dirty water out of your nose.
Yeah, not very effective.
It's
So
not
right. I've actually used your nasal spray, the Citra drops, and I've also within the healing journey, and thank goodness I'm so much better than I was 4 or 5 years ago. And I think in part was using your products, getting myself out of the environment, nourishing my body, detoxing, all of these things combined. But one thing that I did find effective was washing out my sinuses with the um oh, you're a little bit frozen. I don't know if we lost connection there. Washing out my sinuses with the nasal pure spray, or the nasal rinse, and then the Citra drops. And so I found that to be very effective. For someone who is moving out of mold, how often would you recommend that they are flushing their sinuses and addressing that part of their treatment?
Well, that's a good question. So there's a major principle here that's really important. The most powerful treatment involves removing the antigen, which is causing the reaction from the body. That's instant. So when you rinse your nose out, you're removing the antigen, which is fungus, from your nose, and that's what's causing the allergic reaction. So that's more powerful and immediate than any medication of any kind. So
Mhm.
just remember that. So like if you had somebody that had anaphylactic shock, for example, if someone had an allergy test, a skin wheel to
Mhm.
test for allergy, they put a little prick in the skin, and then if the size of the swelling around that prick is graded, and that's how they decide what dilution to use to neutralize them. So if, let's say you put a little wheal in the skin, and somebody started to have an anaphylactic reaction to that, so they couldn't breathe and they were going into shock. What will work faster than anything on the planet is actually removing that. If you just actually cut it out, I'm not saying that's what you do, it would stop immediately. The reaction would stop. So the same faster than medication. So same in the nose. When you wash it out, you're removing the causative antigen. So that's more powerful than any medication you put in your nose. And when you put it in your nose without washing out, you're putting it on top of mucus, so it doesn't do as much good. Wash your nose out first. It's like, no, you clean the wall before you paint it. Right. So you clean the nose out.
You mop the floor, or you sweep the floor before you mop it, right?
That's right. So you clean the nose first, so you're removing the cause, and then you use the spray, and then it works much better, a lot more effective.
Sure. Yeah, that's a really good way of putting it. So if you're listening to this, make sure you're following the order of operations for for your most benefit, really, and better recovery. So tell me, do you have much experience with Marcons? That's a common thing that's addressed in the mold.
Mast cell releasing inflammation, and then there's one more that's, I forgot what it is right now. Anyway, those are all secondary to fungal exposure. So Marcons just means staph growth inside the nose is resistant to antibiotics. Well, who's got staph in their nose? Everybody. It's part of the normal flora. So you only need to treat that if the person's got infection. So it's like if somebody say, look, we got to quick hurry, get rid of all this E. coli in your stool. It's part of the normal flora. So you're not going to ever get rid of staph in the nose long term. You don't need to. You only need to address it when it's causing infection. We have discolored discharge, purulence, and that kind of thing. Then you need to treat it. But if you just treat staph, it's going to quickly get resistant to whatever you use it. So you got to use 2 or more different structured things. And more importantly, you've got to remove the cause, which is the fungus. So remember, the immune reaction to the fungus causes the pit in the lining, which causes the staph. So you want to go upstream and stop the pit formation by removing the fungus.
And is the removing the fungus enough in some cases to be able to remove the Marcons?
Yes. Now remember, you're not going to remove Marcons, but you're going to stop it from being infectious. By what? Stopping the formation of the pit.
Okay. That makes a lot of sense. Yeah.
So when the fungus hits the lining in these patients, the eosinophils come in and to attack it, and in doing so, they make the pit. And that's what causes the staph infection.
Okay.
So you don't want to chase the staph, you want to hit the fungus.
Sure.
And when you get the fungus, you won't have the staph.
Right. And I work with a lot of people to create an alkaline environment and change the terrain in the body. And when you change the terrain in the body, then the body will start to also heal itself, and then infections and it can take care of infections once the vessel is clean and removed from, say, a
That's right. That's right. You always try to go upstream and find out what is the cause and fix that. And then you spend a lot less time and energy, getting well. But nobody's ever gotten rid of Marcons long term with any kind of spray. It didn't have any antifungal properties. If you don't have an antifungal, you're not going to get rid of it. And irrigation is really important in that equation. So you got to irrigate first and then use the sprays. And in people with chronic sinusitis, if they've got an infection, you don't want to just treat the bacteria. You want to treat both at the same time. So you actually get a result long term.
Sure.
But if you're treating both, but they're still getting reinfected, it's their air load is too high. And so you won't be able to help them because they're breathing 3,000 gallons of air a day unless they get their air right. They're going to always have recurrent infection no matter what you do.
Sure. That makes sense. That's why I always tell people the number one thing is to test your environment. And then if you're living
Yeah.
in a moldy place, there's only so much you can do if you're breathing unclean air. Because your body, your nose, your whole system becomes the filter.
That's
And
right.
issues lie.
To just get one thing, you got to get your air right. So what are you putting in your body? The highest volume is air, and the second is water, and the third is food. If you get all those right, you're going to have a good time being healthy all the time. It's going to be harder to get sick. And so, because the air is the most volume, it causes the most illness.
Absolutely, yeah. And so the biggest challenge, one of the biggest challenges is finding the clean environment. And if we are in an unclean environment, fixing that issue. And then that thereby causes a domino effect in
That's where we tried to fix with Microbalance to try to do some things that can get the counts down that are simple. And one is the fogger with EC3 most solution. So that's a solution that you could actually drink that. I'm not telling you to drink it, but if you drank it, it wouldn't hurt you. Somebody's going to drink it. So we thought it was going to be a child, but actually it turned out to be a lady. She drank 2 cups of coffee out of it unknowingly, and she was fine. That had no symptoms. It was fine. So don't do that, by the way. But anyway, you do the spray. It's an environmental spray. You can use it in a fogger, which it goes out 30 feet. We got one of those on the website, but the fogger is really quick because you just hold it and take it around and fog your whole house. You just missed it. You don't want to wet it. And that's instant. And you knock the counts down very rapidly with that. You can do your car with it or anything. And and then we had the candle is like for travel, but we proved that it removes the mycotoxins from the air in 2 hours. It removes 98% of the fungus and mycotoxins in the air, which is really great because when you're traveling, to be able to light a candle and leave the room for a couple of hours and come back and it'd be okay. But you want to try to investigate before you move into the room that it doesn't have a bad smell or it's not going to be a good room. Don't stay in that one, get another one.
Yeah, absolutely. And I will also add, you can do certain things to decrease mold counts and mold spores in its space, but it's not a replacement for remediation and actually finding the issue, right? But I have been in situations where I brought the E3 candle with me, say in like a hotel room or an Airbnb. I actually really like using it in my car, because it's such a small space, where it is a good thing to clean up the air, especially when I've traveled to Michigan or higher humid environments, and there's tends to be more spores and things floating in the air, especially after a rainstorm. Using it in a place like my car, for an hour to 2 hours at a time, obviously supervised, and when you're not driving,
Right.
has been beneficial, and I've noticed a huge difference in using it, and it's just a really easy tool and non-toxic as well.
Yeah, and then the laundry additive too. So the low-hanging fruit in these houses is your washing machine and your car. If you get a lot of people have lots of problems with both of those. So if you get both of those right, you're halfway there. And then the second problem is they got leaks that they didn't know about in the shower, or they've got contamination inside the AC system. And one of the major principles is these patients cannot have fiberglass in their airstream. So in Florida and other states, almost all these systems are lined with exposed fiberglass. So that's like cotton candy for fungus. So fungus grows on it then it flakes off, and then you breathe it in the air. And when that's inside the system, these patients can't get well. So you've got to remove all the, change out the ducts and the plenum when it's full of fiberglass.
You're
And
saying that
most people,
the HVAC systems have a lot of fiberglass in them in certain areas of the country?
Florida's really bad, but it's common everywhere because it's easy. It costs less labor because you don't have to wrap it after you install it. But the problem is you don't want to put anything inside your duct except sheet metal, and everything that you want to insulate with should be on the outside of the duct. Because why? It's going to eventually degenerate and be part of what you're breathing.
Sure.
And fiberglass is a food source for fungus. They all grow on it. And so you're not just getting the fiberglass, but we have some slides showing what it looks like inside the nose. There's these blood blisters, little red spots all over the sinuses, and then that's caused by the eosinophils coming in to try to kill it. But then they keep coming and they dissolve the lining, and then you get an ulcer of exposed bone just because of fiberglass inside your sinuses.
Wow. Okay. So that is another thing to look out for. If you haven't gotten your HVAC system cleaned or looked at recently, that is something else to consider as part of our indoor air quality.
One easy way to see is that when you look at your plenum, which is the big box that all your ducts hook into, if you see sheet metal, that means all the insulation's on the inside, which is not what you want. You'll see the aluminum foil insulation on the outside. That's what you want to see. Same way with the ducts. And so it's really quick and easy to know whether you've got it or not.
Sure. Depending on where your system is set up, if it's in a crawl space, that might be a little more challenging. But yeah, that's a really, really good tip. Thank you for sharing that. I do want to wrap up here, and we can always do a part 2 of an interview, but for sake of time, I just want to see if there's anything that we missed, any other pressing issues that you feel like we should address before we go.
People who have mycotoxicosis, which is a high mycotoxins, toxins for fungus in their blood and urine, the best thing they can do, besides obviously fix their environment, they've got to be able to get those toxins out of their system. So on the Microbalance page, it has the detox protocol, and it's glutathione, NAC, liver cleanse, and then we add one more thing to that. It's a vitamin. The complete family formula is one, but the other one is called Intramax, which we don't sell, but you can get it online. And you get the unsweetened one. You take a capful, and that has got carbon in it, but it's got 413 items in it. So it absorbs immediately, and it's part of the detox program with the other 3 things, plus saline irrigation and the nose spray, and putting the sister drops in there. That's basically what we do on all our patients. The only difference is they won't have a prescribable antifungal for their nose or a prescribable antifungal for their GI tract. So everything else is the same. So that's what we do clinically, and that really works. And then we use oxygen, breathe an oxygen mask. So if you do the oxygen, glutathione, NAC, liver cleanse, and Intramax, that's our whole protocol. It works for almost everybody if they're out of the air.
Beautiful. Okay.
Yeah.
So thank you. So you were saying giving the body antioxidants, nutrition, in conjunction with removing yourself from that moldy, potentially VOC or whatever that trigger is for the body. And I couldn't agree more. I think that's definitely the approach to go, is to remove the source and then add in supports for the body so that it can heal itself. Something we were just talking a little bit off camera, though, that I wanted to mention was the beg spray, the BEG, which is a common component in the shoemaker protocol, what are your thoughts on using that spray? And is it, in your opinion, is it needed or not needed?
Well, if you just talk about Beck spray, no one has ever gotten well long-term with Beck spray. When you stop using it, usually you return to the same problem. It's directed to try to treat staph or marcons. So you've got to treat the fungus both in the air and in the body. If you do that, then you get well long-term. You get all the staph infections go away. If you do have a purulence in the nose from staph, you want to add an antifungal with 2 drugs that kill staph that are structurally different. So that's the way to get rid of it long term. But if you just try to treat the staph, you're not treating the damage to the mucosa that the fungus has caused, the pit in the lining where the mucus collects and causes the infection. Because the staph is already sitting there in everybody's nose. It's no different. But what makes it infective is the pit in the lining caused by the fungus. So that's, you want to just address the fungus first and bacteria second. If there's purulence, you do both antifungals, antibacterials at the same time.
Okay. A question with the pit that you're talking about and the mucosal membranes. When we're talking about the ENT as a whole structure, and a whole like part of the body, is earwax a part of that? Like, do you see a lot of earwax build up and like issues with that? Is there a way to address and like irrigate the earwax, or is that something that also self-addresses itself when you move out of the fungus situation?
Earwax has not been a major problem with most of these patients. If they have it whether they have fungus or not, you know. And sometimes you got to remove it mechanically. Sometimes you can wash it out. But it's not a big problem in the mole population.
Okay.
More so than anybody else's wax, you know.
Okay.
So, yeah, it's a problem for a lot of people, but is moles not the major cause of that?
Okay, that would be a different
Yeah.
link
Yeah.
causation. All right. And so if someone wants to learn more about microbalance, obviously you can reach out to me. I'll include some links to that. But how can, if someone wanted to reach out to you directly, Dr. Dennis, and learn a little bit more about some of the research you've done and work that you are doing, how would they go about that?
Well, we have a website. It's kind of easy to remember. It's called sinus surgery.com. That's one of them. The other one is sinus5.com. That ends up taking you to Microbalance.
Okay.
And then we're in Atlanta, so we have an office number, but most of us you can find on the website.
Okay. And I'll include those links if you're listening or watching this so that you can easily access that. Is there anything else that you want to share in regards to mold, mycotoxins, our cleaning up our environment, cleaning up our body that we haven't touched so far?
Yes, I think we talk about the diet. The diet is really a yeast diet. It's low carbs, no sugar, basically. Because all these patients have their gut lined with candida, which makes gliotoxin. So I tell the patients on the first visit, you got a responsibility sheet on your ledger, and I got one on my side. Yours is your diet and your air. I can't fix that. You got to do the diet in the air. If you get the air right, but you don't get the diet right, you're still going to be sick. And so you got to stop eating bread, rice, potatoes, and sweets. And we give them a written diet. So if you get those 2 right, the success rate of the treatment protocol is about 90%.
Okay.
Some need surgery, some don't. About half of them do. But what I was going to say is, you can go on Microbalance and really do everything that we do for a patient, except you can't get oxygen. So we use oxygen, glutathione, NAC, liver cleanse. That's a triplet that we use, and then the Intramax. And then you wash your nose out using the Citra drops very thoroughly, and then you use the Citra drop nose spray. That's like 90% of what we do. The only difference is you won't have any prescription antifungals in the nose or in by mouth, but you can have the natural ones, which are very helpful. So if you're getting your air right, by some of the air stuff we recommend, and then do all this, you'll start to get better. If you're not getting better, one or two things is wrong. Your diet's not right, or your air is not right. And that's easy to tell by using mold plates. You do a mold plate test, and we're looking for 0 to 4 colonies to get well. And some of them that are really sick need 0 to 2, but generally 0 to 4 is okay for everybody. But if say you got 20 or 30, you're not going to ever get better in that place.
Right. Yeah. And so I know that you use mold plates. I like to use a variety of different factors, especially if, visual inspections can be helpful. I have a moisture meter that sometimes I'll use in places. So there's obviously a variety of tools that we can use. But can you use the mold plates, or do you use the mold plates on things like clothing and belonging? And do you feel like that's helpful?
There are two different tests. One is an air test. We just leave it out for an hour and then cap it. That's okay. But my favorite test is the tap test. So you open the plate, put the media side down and tap it on what you're testing. You tap it firmly 4 or 5 times, and it tells you instantly. So if you're going in a new place and you do that, it doesn't take long to collect a sample. And if you've got like 20 or 30 on a plate, well, that place is really contaminated. And
Well,
you can
how would you know a difference though, whether say from the mold plate of what you're testing, if the air, say the air and the windows are circulated, how do you know that it's coming from inside versus say outside of the building? Is there a way to tell?
Well, everything inside came from outside. So all your air inside came from outside. And the only difference is if you got a filter, it's filtering it. So because if you open the window, you get more of it. But it's always your whole supply of air is from outside. It's not sealed in a can.
Sure.
So,
It just becomes problematic when we have water damaged molds and things that typically in nature are kept in check. And then when they're in our environment, they are, causing indoor air quality problems when it's in such a tight space, and our buildings might not have the ventilation that they used to have or that they should have. And so that's where we start running into problems with our indoor air quality.
well, you can do air filtration. There are these ionizers now called plasma pure 1500s, and you can put, we have a company that puts them in a fan with a HEPA filter on the back. So you put that in the room, that makes 1 trillion ions per second with you want 0 ozone and 0 hydroxyl. So there's no smell. It just removes mold, mycotoxins, VOCs, viruses, and bacteria from the air. So that's a easy, low-hanging fruit to do that.
So I personally use Austin Air. I'm not familiar with one that you speak of, but can look a little bit more into that. But I noticed you said no ozone and no hydroxyls, which I think is really important. Can you speak a little bit more to that of why?
So both of those will damage the cilia inside the nose.
Sure.
And so that's why you don't want to use them. And a lot of products have them, and they're just really not good for your health. It's doing a good job of removing some of the other stuff, but it's also putting stuff that's harmful to you in the air. And you don't want that. Most of these ionizers do that. And then the other thing, they have these UV lights on systems. And that's really old technology. It's not a bad thing. It's just not worth it because the organism has to have a 30-second dwell time in the UV light to work. Well, air going past that thing doesn't have 30-second dwell time.
Interesting.
And then the lens gets dirty and then it doesn't work. And then you got to replace it and then they're expensive. So To me, it's a total waste of time for those things. That's stuff, old relics of the past.
Right. That makes a lot of sense. Thank you for explaining that. I haven't heard someone explain it in that way before. And I do think just like if we're filtering our water, there comes a risk also to completely filtering like through reverse osmosis. We're taking and stripping all of the minerals out. So what do? We can add minerals back in. It kind of sounds the same thing with our air filtration. Not all devices are created equal. And things that are producing hydroxyls or ozone in the air can be damaging to our bodies, and we might not know what we might be removing harmful things, but we also might be introducing other factors that we're not necessarily thinking about. That's what I'm hearing you say.
Yeah, and the Austin air is fine. Those things are great, especially when you get the carbon in there.
Okay, well, that's why originally what piqued my interest is I tried 5 different types of air filters, and I haven't tried the one that you suggested. I will look into that. But I couldn't find and everyone was, saying we do this, we do that, we filter out X amount, we have carbon filtration, but I just found Austin Air has the most carbon filtration that I have found in a unit. They have like 15 plus pounds of carbon versus most units have like 3 or less pounds. And obviously, the amount of carbon is important to be able to filter out the VOCs and other contaminants in the air.
Yeah, now that's true, but now you got to be careful. Even though it's good, you got to change it because when it gets full, it puts it back in the air.
Mm,
So that's what you have to watch out about carbon. As long as you do that, you're good. But
mhm.
you have to be sort of diligent. And some areas don't have much chemical contamination, so they don't get contaminated or full very
Sure.
frequently.
If you're living in like a newer apartment, say where there's a lot of things off gassing and new paint and new cupboards and that, it's probably going to be a lot more clogged up faster. Thank you for taking a more holistic approach as an ENT doctor and for helping so many people with the work that you're doing. It's really refreshing to see a medical professional take their knowledge and their expertise, listen to their patients, and then come up with out of the box solutions to help people really heal at the root cause. So thank you for your dedication to that and raising more awareness around mold because it is an elephant in the room that obviously needs more addressing. And I'm glad that you're being a part of the solution.
Well, I'm glad to do it. The one thing that's kind of exciting here recently is we have developed artificial intelligence software that another company had, but we figured a way we can see mycotoxins in the brain,
Mm.
sinuses with this technology. So when that gets published, it's going to change everything because then the doctors will be able to see their sinus x-rays are full of mycotoxin and the brain is too. So basically, if you have it in your urine, it is in your brain for sure.
Sure. Yeah, and if you can test in your urine through a couple different companies, uh,
Yeah.
and
We'll
that'll be interesting if that becomes like a mainstream um thing that patients can get covered through insurance. Yeah, that could be really eye-opening.
Yeah, I think Medicare pays for it, but I'm not sure. Others don't pay for it though. Uh,
The AI technology you're referring to?
yeah, there's a company that I have a friend of mine who's chairman of the company, and that what they do, they take all the satellite data and they can see enemy submarines underwater where they are. So what we did is took all the mycotoxins in glass vials and CT scanned them and MRI scanned them, and then ran the algorithms till we could see something in the test tube. And then we had tissues that we taken out of the sinuses. We knew the exact location of the tissue and which mycotoxin was there because we did an assay on it. And so then we have a match. So then we know we can really see it in the brain and in the sinuses, especially with a patient with a pituitary tumor that was making cortisol. So she had a 140-pound weight gain in a few months. And so this is going to be lethal to her not to get the tumor out. So neurosurgeon took out the tumor through her nose, and we got a piece of the tumor and did mass spectrometry on it. Found 11 mycotoxins in the pituitary tumor which is what caused the pituitary tumor. And so it proved that we could see that mycotoxin in the pituitary tumor once we ran her pre-op MRI scans through that.
Mhm.
So we know what we were seeing, because we have the tissue proving that's what it was.
Sure. Yeah, that's incredible research. And I remember watching, I recently watched a talk that you sent me. I forget where or what it was in regards to, but a piece of it was you were sharing the link between cancer and mycotoxins and finding mycotoxin in cancerous tumors. And that was really fascinating.
Yeah, it's only 87%. Not that bad.
Yeah, that's a really high percentage in all types of cancers, breast cancer, obviously, especially breast cancer is, can partially be a lot of times affected by hormones and estrogen dominance, which we know is
Right.
directly impacted by the environment. Mycotoxins and specifically do affect, like you're talking about, the pituitary gland and hormone production. So it's all interlinked and it's really fascinating. And I'm excited to see more research and hopefully modern medicine practices catch up to the research that we already know is there.
Well, the thing is, it's going to be hard to get them interested in fixing the environment, but you can't really help the patient unless you get environmentally active.
Sure.
So eventually, I think what needs to happen is you have a national company that's really medically trained versus trained by another environmental person.
Mm-hmm.
Need to be medically trained, of what happens to the patient, so they'll know about fiberglass and all the other stuff, and then have a national company with high standards that can do mold remediation properly. But there's so many of them, and honestly, I haven't seen one do it right yet. So that's why we train these guys what they have to look out for, and they do a really good job. It's two different companies, but it needs to be everywhere.
Mm-hmm.
They
There
do.
definitely needs
I'm
to
not
be
saying
more
they do bad
standard.
work. They just don't get the job done correctly. They do a lot of good stuff, but they don't do it all correctly.
Right. Well, I'm glad that you're on top of it. Perhaps after this interview, we can swap information and on those companies, and I'm happy to pass those along as references for people who might need
That'd be good.
more information. Yeah. Well, thank you, Dr. Dennis, for taking the time to talk with us today. I really appreciate you sharing your knowledge and expertise and time with us. As always, if you found this information helpful, please share it with a loved one, friend, family member who might benefit. And until next time, we will see you later. Thank you.
Thank you.